Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Osmund Agbo and Robert Chelsea. Thanks for joining us today, Osmund and Robert.
Thank you so much for having us, Kim.
Yeah, thank you, Kim.
You're welcome.
It's our pleasure to be here.
I'm very excited to have you both. I know this is going to be a fantastic conversation. I've been looking forward to it for quite a while.
Same here.
Good. So by way of briefly introducing you, because I'll have you introduce yourselves more in just a moment, Dr. Osmund Agbo is a pulmonary and critical care physician, author, journalist, monkey, and human rights advocate. And Robert Chelsea is the first Black man to receive a full face transplant, and skin color is significant because indicators of tissue rejection, such as skin turning pink and knuckles turning white, would not be as obvious. And also, before I ask you to talk about yourselves, I just wanted to share that you're both so thoughtful. That's something else where you have synergy. And Robert had reached out to me on LinkedIn earlier this year. And then when you were coming to see your face transplant surgeon, you said that you wanted to meet me. So I was honored that you wanted to meet me. And we met. It was actually during the eclipse, right? We were
That's right.
at your hotel actually during the actual eclipse, and we had such a great conversation. And then after, you wanted to make sure I got home safe, you told me to text you, and I just thought, with all you have going on, that you were thinking of me. It just filled my whole heart. And then Osmond, I've sent him a couple messages over the past year. He's been a prolific writer for Kevin MD, and I've really appreciated the variety of articles that you submitted, Osmond. And I had, reached out to you a couple times to share a couple that were, meaningful to me. So we just happened to be communicating, and you asked me how I was doing, and I tongue in cheek said, I'll wait for my doctors to tell me, thinking that I was fine because I just had a scan. And as we were communicating, my doctor called and told me I needed another surgery. And I just couldn't believe it. And then you ended up being the first one to know, just because we were communicating. And my gosh, as busy as you are, you were like so nice, and you sent me your number, you offered to chat, and we did eventually. And you both just fill my whole heart, and here we are. So I'm the lucky one that I get to have you both on. So thanks.
Thank you so much, Kim. We're actually very lucky, especially as a physician. The fact that you're sticking up for us, it makes, it gladdens my heart, because as you know, physicians don't have many advocates. We're actually the worst advocate for ourselves. So, it's heartening to see somebody like you devote your time and energy to supporting us in the best way you can. And we appreciate that. Thank you very much.
Well, thank you. It just fills my whole heart all the time. And so today we'll be talking about, we're actually going to paint a picture of both sides of the table. Osmond is a critical care physician, and Robert having been a critical care patient for a number of months. So as we get started, I always ask what you'd most like our audience to know about you. And Osmond, would you like to go first?
Yeah, okay. I mean, you've said it all, from your brief introduction. I'm a trained physician. My bias is in pulmonary critical care, of course, after my residency in internal medicine. I'm here in the great state of Texas, precisely in the Humble area. So my daytime job is a physician. But outside of being a physician, yeah, like you rightly pointed out, I have a lot more interest. I'm an author. I'm a syndicated columnist, both for Kevin MD and some newspapers in Nigeria, where I am originally from. And I'm also an entrepreneur. I do real estate by the side, Of course, I'm not Donald Trump and the rest of them. Yeah, but so I do have my hands, in a couple of things, and that's part of what makes life exciting for me. I'm married. I have 2 teenagers, who are struggling to keep up with. My wife is an accountant as well as a respiratory therapist. So we have a small family of four. But that pretty much summarizes who I am as an immigrant, as a Nigerian immigrant in America, trying to pursue the American dream. Thank you so much.
Well, thank you. And actually, at the end of the month, I'm going to be interviewing a medical student from Nigeria. His name is
Okay.
Ransom. And he actually, I'll have to introduce you to sometime because he is also a prolific writer. And
Okay.
you two would love to get to know each other.
Sure, sure. What do you
Um,
call your name? Ransom.
yeah, Ransom, I'm
Okay.
Nima. Yeah,
Okay.
yeah.
All right.
So I'll have to spotlight that episode for you. And
Okay.
I'll
Sure.
introduce you.
Sure.
So Robert, what would you most like us to know about you? Actually, and you could go into sharing a little bit about your story if you want to.
Well, okay. There's not that much that I would want you to know about me. I could share my story, that is, hopefully it would inspire others, but there is nothing. I think there was a man that wrote, within me, there's no good thing. So I don't really see the significance in speaking about any one individual. But I do see the importance of sharing what our Heavenly Father can do for us. What more important subject if I had the platform, because the experience that I'm sharing with you, who handled it for me, who carried me through. See? What is it that I can claim that I am or have done that wasn't orchestrated or allowed? Just as, like Osmund was saying, you got teenage boys, and you are trying your best to keep them in some degree of right path. And Ken, I know about your daughter. It's very important that I have been assisted by our Heavenly Father. It's even more important for me that I learn how to follow Him. You know, oh Lord, I want to do this. Can you help me with that? Please forgive me for this, and be merciful to someone. I can ask for a lot of things, but I think there was a man that said, "All men know your works, for you open up the Red Sea and let men pass through. You not only you let me hit a rock so that water could come out. It said you provide the sun and the moon. All men can see your works, but I want to know your ways." So the most significant, the most important about Robert Chelsea, I want to know more of God's ways.
Yeah, well, thank you for sharing because I know when we met, we both talked about our faith. And for some people having gone through, what you went through, it's just really incredible that you've still been able to keep your faith and continue on because you've been through more than most people will ever go through. And Osmond, I was wondering what inspired you to become a physician, if you'd like to share that.
Oh, okay. The money. No, I'm just kidding.
Yeah.
No, so growing up in Nigeria, I was born during at the end of the Nigerian Biafra Civil War, which has been ranked close to the Holocaust. But of course, it didn't get the kind of publicity that the Holocaust did. So at the time of my birth, there was so much famine in the land. There was so much hunger. There was so much disease. So their biggest hero at the time was being, seeing a doctor, because we had a lot of doctors from, Doctors Without Border and all those other NGOs that came to salvage the situation. So being a doctor was seen as, some almost like close to God in some ways. And, my parents, growing up at that era, my parents, basically they reared us towards healthcare. It wasn't necessarily to be a doctor, but to be in a place where you can touch people's life. And naturally, I just eased into that role. And of course, growing up, I got exposed to hospitals and all those things, and I just naturally fell in love. You know.
Wow, that's
Yeah.
terrific. And Robert, so knowing that Osmund is a critical care physician, I believe that you spent months in critical care. But you don't remember any of it. Did you want to speak just a little bit to your story for Osmund to have a frame of reference?
Yes, I remember a great deal. Well, actually, I was in an auto accident. A drunk driver hit me, and eventually my car blew up. It was on a freeway in Los Angeles. So I immediately, as a matter of fact, August the 5th, which is basically next month, it'll be 11 years ago. I was in a coma for the first 6 months. I stayed in the hospital about a year and a half. I was sent to different hospitals, long-term hospital, and then back to a regular hospital for various adjustments. And of course, as a burn survivor, I had about at least 30 surgeries before I came out the coma. So my lips were burned off, part of my tongue, and my face looked like a Halloween mask, Yeah, and of course the rest of my body as well. So that's kind of how my journey started in terms of the last 11 years. And I was introduced to transplantation because the plastic surgeons, dermatologists, and so on, they knew they couldn't do anything about, like, in terms of my lips, part of my tongue was burned off too. So they could only put a flap on in order to cover my teeth and gums and protect them, but there would be no control for my lips with a plastic surgeon. And my last plastic surgeon, who I still interact with, he had a friend that studied under Dr. Bolden Tomahawk, who is one of the premier face transplant physicians. And as a result of that, they introduced me and they called me, and that's kind of how I eventually were able to have a face transplant. Just so that you know, Osmond, I am the oldest face transplant recipient, and by over 10 years. The cutoff for having a face transplant was 50 years old at the time, and I was already over 64. So now I'm 73. I'll be 74 this year. Yeah.
And so, Osmond, you can go ahead, and what does that bring to mind? Because you've obviously had intense experiences on the other side, being the physician to receive patients.
Yeah, first of all, I want to say huge congratulations to Robert. Right from when you told me this story, I've been seriously moved. Robert, cuts into one of my themes in some of my writings. I wrote a book called Black Grits, White Knuckles, The Philosophy of Black Renaissance. And the book is all about human agency. That is to say that as humans, we face all kinds of challenges. Obviously, Robert has gone through some very, very rough patches. And, ordinary mortals could easily go to one corner and sulk and get depressed and do all those kind of stuff. Ask questions. Why me? Why should it be me? Why should this happen to me? Life is not fair, and I think that we all have to get comfortable with that. When you know that, you know some peace. And I've always been reminded that when you're in a situation, things you can't change, let it be. But there are millions of things which you can change. Now, Robert decided to take things into his hand and decided that, okay, even with all the things I've gone through, instead of being somebody that everybody takes pity on, I should be the one to even motivate others. And that is very, very courageous. That is very, very exemplary, and it speaks to the idea of human agency. So I am deeply, deeply, deeply moved by his resilience, his strong heart to be able to still stand up and do what he does. As a critical care physician, I meet a lot of people, at, a very critical time of their lives. Many of them, unfortunately, are in a situation where we can't have conversations. But at the end of the day, you get to hear their stories from their families, and you see all kinds of, places they've been and how, you are in somewhere and all of a sudden your life is upended. So when you look at all those things, then begin to consider what you and Robert are talking about. The concept of faith and God and all those kind of things. You start to redefine what is important to you in life. So I'm just gonna say that I'm deeply motivated by what Robert is doing, and I wish that a lot of people will have the opportunity to experience and hear about his story and get motivated by that.
Yeah, well, thank you, Osmond, and you said that so beautifully. And Robert, you can speak a little to like your website and the foundation that you have. And just like Osmond, I mean, I've told you that I've been so moved that instead of just going inside of yourself, that you're trying to be a voice for transplant patients and to raise awareness. If you'd like to speak to that.
Yes. When I realized that we were going to go through with the transplant, friends, we got together and established a foundation using my name. And that was so in 2017, the end of 17, we established the Robert Chelsea Foundation. And as a part of that foundation, we have if you will, an arm of that foundation called Donor's Dream. And that's obvious. Hopefully it's an obvious title, because I would not have this face had it not been for a family that was kind enough, generous enough, thoughtful enough to offer their loved one as a donor for the face. That's a specific area. And there's only under 50 people in the world that have had a face transplant. I happen to be the first Black. But I have made decisions as a result of the various surgeries and, encounters that I would never have imagined. But the decision, so that you understand how I see my life, the decisions were my decisions to enjoy the ride. See, I was exposed. I'll try to illustrate it like this. We all know that there's so many beautiful fish in the sea, beautiful animals, plant life, etc. Just gorgeous. We've seen these. And yet we also know that in the depths of the sea, there are possibly many more beautiful plant life and animals, fish. Well, I had a chance to see it. This experience has put me in a deep dimension where I could do nothing but appreciate it. I didn't do this. I wasn't necessarily courageous. Oh, Robert, you are just, oh, I could not have, nobody could have done what you were just the bomb. No, I enjoyed the ride. God provided it. Now, if He sends you to the depths of the valley, don't you know that just like you as a parent, don't you know that you are going to make sure that it's safe there? Of course. And if I say, well, no, I don't, as soon as we go to the valley, we want to get out, right? We want to, go to a place that's more comfortable. But if we allow God to place us in that valley, we'll discover there's lilies there. So I want to enjoy those lilies that I've been exposed to, and the daisies and the roses. See? And everywhere I have gone in terms of my physical journey, He has provided a degree or a space of comfort so that I can continue to enjoy it. And that builds my trust, builds my faith. So what others might say, oh, you're just a... No, it's because I've had a good father.
Yeah, well, and thank you so much for sharing that, Robert. And it just speaks to no matter what we go through in our life, right, that there can be people there for you. You can use your faith. There's resources you can tap into to really get through anything. And that's just so beautiful. And even though with all that's happened to you, you don't let it define just who you are, that you're more than a face transplant patient, right? You're that you have a deep faith life and you're helping other people, and that's just really beautiful. Osmond, I'm wondering what that brings up for you.
Yeah, I mean, facing the kind of thing that Robert, and it's not just him, a whole lot of other people that we encounter every day, there's always that role of faith, especially when you're encountering situations that there's nowhere else to go, And I say that without humility as a healthcare provider, because there's been situations where we have a patient, we don't even know how to help them.
Yeah.
They just, the kind of presentation they give does not, it defiles all the diagnosis you've seen in textbooks, and there's just no way. And sometimes you just have to, sit back and, tap into your inner self, which brings that aspect of faith, knowing that there is a superior power somewhere that is looking down on us. But that's it. That is not to say that we don't have to exploit everything else that is humanly possible. God is created for all of us. Yet there are people that sometimes all they do is resign everything to God. My take about it all is, while we tap into faith, while we know that we are spiritual beings, we have to make sure that we don't outsource what we should do for ourselves to God, which again brings us to the topic of human agency that I mentioned earlier. Robert is a typical example of human agency. Again, he could have resigned himself to faith and go by one side and start sulking and asking God, why me? Why not this? Why not that? No, but he was able to rise up to the occasion and take the bulls by the horn, do those things that is humanly possible, and leave the rest to God. And this is what I advocate. This is what I try to practice every day. And this is some of the lessons I impart in our two kids.
Yeah, that's so beautifully said. And Robert, when you and I met, one thing that we spoke about that we're both patients, and we're not getting into a lot of the particulars of your situation, but we're both on medications that keep us alive, right? And that we both need doctors. And you wouldn't obviously be alive if it wasn't for doctors. And so one of the purposes of this YouTube channel is to support and inspire doctors. So I was wondering if you have any suggestions for patients who wish to support their doctors, or any messages to doctors.
Yes, there's many messages. Because Osmond, you mentioned an article that you wrote regarding white knuckles, and that is, in my case, because my organ is external, that my face transplant, they can see that. If you look at, you see the scar on my head there, there's no question that something is, unusual about this, the way this head is structured. And because you're the first Black, all the physicians have no clue of how to identify external signs of rejection. So the white knuckles is one of the areas that doesn't apply to me. Blue lips does not apply to me. Pink face, red face, pale face doesn't. Now, as my mother would be able to see my face and say, "Oh, something's wrong with you." But because most of the physicians are at least that had worked with me, are of one color, they were not able to. And almost every time there's an infection, they can't detect it early because they have no external no experience with seeing a Black person's face that is externally. So they detect it through blood samples, etc. And that gets to the point where, so weak that, like near death and back on the ventilator and, things like that. I was in the hospital 94 times last year. And so when you look at things like that, the physicians care, and they can only do so much in the way of caring. The difference, I think, just as each culture can identify with one another, and they tend to do a little extra as a result. They not only do they do a little extra, but they can, because they can identify a little bit more with that person's circumstance, the background, etc. So they can do a little bit more. Now, just think if the majority in the U.S., if they're one color, then they do a little more for that one color. So it's important that we have a diaspora full of colors, so that they all can give the very best they can give. And I also think that if you can give the best you can give, just based on humanity, I think there's a way that you can even improve that. And that is, I'm talking about not just physicians, but anyone, but in particular the physicians or the medical staff, because they are in charge of their life at that time. So I think what I refer to as iniquity must be considered and eliminated. Now, there is sin. We all have sin. I could sin right today, but that sin is gone. Iniquity is the sinful nature of the heart. It's the portion that says, well, I can only do so much for you. Now, if you were my child, I'd do more, right?
Mhm.
Yeah. So that I can only do so much for you, and I'm not gonna do anymore. How many times should we forgive the person? 7 times? No, forgive them 70 times 7. Well, I'm not gonna go that far. That's iniquity.
Well, thank you, Robert, for sharing that. And also, you're speaking to the importance of diversity, right? And the critical nature of us having all different kinds of doctors, right? And from all different kinds of cultures available. So thank you very much. And Osmond, you mentioned a little bit in the beginning how you're also a writer, you dive a little into real estate. I was just wondering if you have any top tips for your colleagues or wish to share, like what has helped you overcome challenges. Because, Robert's more than a face transplant patient. You're more than a doctor. We're all humans with a lot of different aspects, many facets to our personalities and who we are.
Yeah, oh, yes, absolutely. You know, what what Robert just said is somehow music to my ears. Jim, I don't know if you caught up with one of my last articles, it's about the painful realities of Black patients. Um, because as you know, I work in the realm of critical care. And that article was inspired by my personal encounter because there was a patient that I saw. Of course, we're not going to mention names to make sure. Yeah, but basically, this patient has polycystic kidney disease, and she's been coming and going from the hospital with abdominal pain. And this person, just the background, she has 2 degrees, is gainfully employed, so it's not one of those people that you say, okay, this one is just some drug-seeking human beings. Yet, many of my colleagues, thought that she was faking her pains and they were under-treating her. And so it was a revelation to me because I now had to go back and read articles about how Black patients have always been undertreated for their pains. Not necessarily, some of the reasons is not necessarily intentional. It's just some, cultural bias, i.e., Black people are able to live with more, that their tolerance for pain is higher, you know. So those kind of unconscious bias that
Yeah.
you carry along without knowing that. Yeah. So back to what Robert says, there is reason to be open. There is a need for, I'm talking to my colleagues now, for all of us to be very open and to learn new things and know that what applies to patient A may not necessarily be the same thing with patient B, and to have that humility. It's difficult to say sometimes that, I'm not sure. I may have to look into this further, because it takes a measure of humility to do that. But I believe that if we as physicians, not just physicians, but anybody else, if you try to live by that creed that there is much you don't know than what you know, then you will have that mindset to be able to sit back sometimes. And even when you don't believe somebody, at least you have that ability to listen more, investigate more, and say, perhaps these people could be right. Perhaps I could be the wrong ones. So I think that's one thing, whether it's when we make mistakes and acknowledge, like Robert rightly pointed out, he's the first, Black person with this kind of experience. So, of course, doctors are not going to, plug the experience from thin air. So it starts with him, and there's going to be a learning curve. So as long as Robert himself understands that, okay, some of these things, some of the mistakes made are also honest mistakes. It wasn't anything that has to do with, oh, just because you're a Black patient, we don't care. It's just the fact that they just didn't have the knowledge at the time. Maybe the next Black person who gets transplanted will have a better experience because they can now go back to what happened to Robert and make amends. So it goes on both ways. In that way, we, instead of having a pre-made opinion, we actually, prone to listening to each other with a genuine need on a need to know basis, not as aware of saying, hey, okay, I'm just getting this because I am so this and that. So that's what I would say about that. Thank you.
Yeah, well, thank you. That was so well said. And it brings to mind, I just read something in the last day or so, is to kind of check yourself when you think you're being objective. In a way, it made me question, can anybody really, it's not for us to answer now, but to ponder, can anybody really be objective about anything? Like you have to realize that we all have biases, and you might think you're being objective, but if you don't check your underlying biases, your objectivity is actually subjective. So I feel like we could speak for hours, and I'm sorry that we have to wrap it up now. Robert, how can our listeners get in touch with you?
They can Google my name, might be the easiest, or donorsdream.org, robertchelsea.org. Of course, they can call me, but I am in the New England Journal, Wittipiki, and of course, as I mentioned, they can Google me. And I would love to have their opinion, their thoughts, their expression, and be more than happy to come wherever they are to share. I'd like to do what I call show and tell. It's very important that, especially for students, to see what conditions an individual is under underneath their clothing. The kids can, that child could have been electrocuted or in a fire like myself, birth defect, anything. And so they don't walk and talk the way you do. And so what I try to do is make sure that the students can see what has happened to me, not on my own volition, but this is what's happened. But don't treat me or try not to treat me any different. So in order, so that you don't have the peer pressure or the bullies as much, you can have a little bit more empathy.
Right. Well, thank you so much. And I'm just so honored that I was able to have you both on today. And Osmund, how can our listeners get in touch with you?
Yeah, so my email is one, eagleosmund@yahoo.com. That's EAGLEOSMUND@yahoo.com. But of course, if you put my name on Google, Osmund Agbo, you see tons and tons of articles and things about me there.
Okay, well, that sounds great. And I'll put those links in the show notes. So in closing, thanks again for being my guests today, Osmund and Robert. I'm just, again, so honored to have you. And to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Yeah.
Thank you very much.
Yeah.
My pleasure being here.
Thanks.
I like the way you say that, Kim. Well, it's very nice.
Thank you, Robert.